Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to speak with Mr. Ken Perez this morning, Vice President of Healthcare Policy for Omnicell. And he's joining us here on Health Professional Radio to talk a little bit about himself, a little bit about Omnicell and the launch of Omnicell One. It's the first tech-enabled service for health system pharmacies that leverages cloud-based data and predictive intelligence. Welcome to Health Professional Radio, Mr. Ken Perez. Thanks for taking the time today.
Thank you so much, Neil. It's great to be with you.
Well, tell us a bit about yourself, just a bit of insight into your background, and what is it that Omnicell does?
Yeah, well, I'm the VP of Healthcare Policy, as you mentioned, and I work actually in the Strategy and Business Development Group as well as the marketing team at Omnicell. And it's a great, wide-ranging kind of job. You know, Omnicell is all about, it's a healthcare IT company, and we're all about medication management solutions and medication adherence tools. That's what we do, primarily to the healthcare providers, but also to health plans.
Now, compliance, adherence to medications, the management thereof, it's very, very important, especially now with so many people staying home for obvious reasons, but for many other reasons as well. Where do you see compliance right now from an IT standpoint when it comes to managing meds from a pharmacy?
Well, there's two aspects of compliance. There's compliance with regulatory authorities, and that's primarily, that affects all the healthcare providers, but also there's adherence, which is people taking their medications as prescribed. And that's, especially in the time of COVID, that's one of the big challenges because people are reluctant to go to healthcare facilities. And so we've seen things like vaccinations going down and people not taking their medications and paying attention to that. So those are two aspects of the whole general concept of compliance.
When it comes to artificial intelligence or predictive intelligence managing pharmacies, are we talking about making it easier for the pharmacist? Are we talking about eliminating the pharmacy tech, the pharmacist altogether? What are we striving for?
It's really, the big picture here is it's really a transformation of the whole pharmacy enterprise across the care continuum to be more automated. It's really a change, a transformation of the roles of all the people involved in pharmacy, pharmacists, pharmacy technicians, and other staff, so that they can operate at the top of their license and be more efficient and be more patient-centered in their work. They really want to be involved in patient care, but unfortunately right now, Neil, so much of their time, in fact, we have studies that show 75% of pharmacists' time is actually spent in non-clinically related activities, more administrative tasks, and that just bogs them down and prevents them from doing what they love best and what they're trained to do. So there's real opportunity there to transform the roles of pharmacists as well as pharmacy technicians to be more patient-centered.
Now, Omnicell has launched Omnicell One as a solution to what we're talking about now. Is that correct?
Absolutely. We just recently announced Omnicell One, and in fact, this month, it's generally available to all of our customers. It's a tech-enabled service, as I think you mentioned earlier.
So give us an example of a hospital or a pharmacy healthcare facility utilizing Omnicell One to make some meaningful efficiency changes.
Yeah, so here's a classic example. I mean, Omnicell One has data analytics, workflow tools, and expert guidance from data scientists and clinical experts. And so think of a situation right now. There are over 200 drug shortages going on in the United States. And you're the head of pharmacy for a bunch of hospitals and clinics, and you're trying to figure out what do you need to do with that. With Omnicell One, we have data about your inventory levels. We also have benchmarking data across other hospitals and health systems. And so you can intelligently, using Omnicell One, manage your inventory. And so you can what's called shop your own shop, get the medications that might be in short supply at one hospital and move them over to the other hospital with the visibility and the insights from Omnicell One. And that would be a more efficient way of managing and dealing with drug shortages. That's just a simple example. That's a classic one where it's really hard to get that visibility and insight. And Omnicell One provides that.
Now, on the adherence side, when it comes to patient management, that's a huge aspect as well. How does Omnicell One address that?
So Omnicell, ultimately, we're also providing services to retail pharmacies, outpatient and retail pharmacies. And so therefore, we have visibility into the use of medications, the adherence to prescriptions of literally millions of Americans. And so we can combine within Omnicell One, extend into the whole continuum of care all the way to patient adherence, medication adherence. So that's something that's going to be forthcoming.
Now, is this something that is is only utilized by large pharmacies, large healthcare facilities? There are still many small pharmacies that exist. Are they seeing some of the same challenges, based on what they were traditionally faced with, but now with COVID-19? Is this something that can help them as well?
Yeah, I think every hospital and health system really is dealing with various challenges. It's just one of those real issues. Over pretty much half of all U.S. hospitals purchase products and services from Omnicell, and so we have, just by listening to them and understanding their challenges, we know that small and large facilities face these kind of challenges of inventory management and of medication. So it's a universal, a uniform problem.
When you speak of universal, does this same platform lend itself not only to pharmaceuticals, but to other aspects of healthcare, like home healthcare, equipment facilities, physical therapy facilities that have huge inventory that needs to be managed, say maybe veterans facilities?
No, we're really focused on medication management. That's our focus as a company. I mean, the technology, of course, can be adapted, but we're really focused on medication management.
Where can our listeners get some more information about Omnicell and Omnicell One?
Obviously, Omnicell's website, omnicell.com, would be a great source. We also, within that, there's a bunch of information about Omnicell One.
And that would be omnicell.com, or is it spelled like it sounds?
Yeah, OMNICELL.com.
Well, Ken, I appreciate you coming on and speaking with us briefly this morning here on Health Professional Radio.
Well, thank you so much, Neil. It's a pleasure.
And once again, that website is www.omnicell.com. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Ken Perez, VP of Healthcare Policy for Omnicell. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to our podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.